Good afternoon, everyone, and thank you for joining us as we discuss the NJCAA-USCAH accreditation to elevate student athlete health, safety, and well-being. We're excited that you all took time out of a summer day to join us today. And what we thought we'd do with the format today is, as we've started to work with some institutions individually and really start to see where some of the questions are, is do this in a frequently asked questions format. I think between Angie, Ray, and myself, we've had a number of schools reached out with some questions, and so we thought we would do it in this format. My name is Bob Sweeney. I'm an athletic trainer and a member of the team at the U.S. Council for Athletes Health. I'm joined by Angie Beisner and Ray Everson, also athletic trainers and a vital part of our team with this accreditation program. Just by way of background, USCA has been working with the NJCAA for a number of years, even dating back to the pandemic. And we've both worked with the national office, Dr. Parker and Jeff White and others in the national office, but then also with the Welfare and Safety Council. We've collaborated with that group. So we've gotten over the years to learn a lot about the organization as a whole and its member institutions. And along the way, we've had conversations with them about providing tools to the institutions to allow them to evaluate where they stood in terms of best practices when it comes to taking care of their athletes on their campuses. We're very aware that each institution looks different, and each institution has different resources when it comes to the care that they give their student athletes, whether that's athletic trainers, team physicians, outreach partners that they may have for coverage of their events. So our years with the organization, with the national office, has really allowed us to learn a lot about this. Starting in the winter, the national office started to put together a new health and safety bylaw. They got a lot of feedback from the Welfare and Safety Council. They received feedback from our chief medical officer, Dr. Jim Borchers, and I'm sure they received feedback from other organizations, whether it be the NAIA, NCAA, and other large organizations that bring forward sporting events. And with that, they created a new health and safety bylaw that was approved in spring of 2026. And that's really where the genesis of this accreditation program came. I think to start, what I'd like to do is Angie, if you don't mind, talk to us a little bit about the new NJCAA Health and Safety Bylaw. What are the main points in it, and what does it mean for the institutions?
Yeah, thanks, Bob. And we're really excited to be assisting NJCAA institutions with this implementation. I think this is probably something that a lot of athletic trainers and people on the Health and Safety Committee have really wanted for a while now. It's just a little bit more structure to how ensure health and safety best practices are being met on your campus. So there's a couple different things in the bylaw, and two that are of the most importance is really the independent medical care and designated an athletic healthcare administrator. So from an independent medical care perspective, it's vital that athletic healthcare personnel providers have the ability to manage medical decisions and return to play decisions for student athletes. And to help support that, they're asking that you designate an athletics healthcare administrator. So the role of the athletic healthcare administrator is really going to be responsible for coordinating the student athlete health and safety initiatives and serving as the contact for the NJCAA regarding health and safety communication. So they want a direct line to know who is responsible for health and safety on your individual campus. And one of the roles and responsibility of that person is really going to be maintaining accreditation through USCAH's accreditation services. Our goal is really to help support these institutions to making sure that they're meeting best practices and hitting NJCAA standards when it comes to things like concussion management, CPR certification, AEDs, those basic minimum standards that are required for NJCAA institutions. So I will say this is just the start. We're starting to have these webinars now so that we can get people enrolled so they can start using some of the free resources that will come as part of this accreditation process. Our goal today is answer questions on how the accreditation would work, and to help people feel comfortable with what the process is going to be like, and to help you understand how easy and simple this is going to be for each institution while also providing you some additional resources to help on your campus.
Great, thanks, Angie. I'm going to give the next question to myself just because I've answered it quite a few times. We've had a number of student institutions reach out to ask us who should be the athletics healthcare administrator on a campus. What's the role of that person? How does all of that work? Really, the athletics healthcare administrator is someone that each school, each athletic department should designate to receive communications from the national office, from USCAH, really from anyone on issues pertaining to student athlete health, safety, and well-being. And that could be, medical care for an upcoming tournament. That could be something from the national office that may be changing. For us, it's our point of contact for the accreditation process, but it's somebody just in that role who can receive and respond to communication when it comes to, the health, safety, well-being, the care of the student athletes. Most likely on a campus, it's going to be the head athletic trainer or your director of sports medicine. It may be your head team physician if you have that. It also, if you don't have those folks in place, if you're doing event coverage, with an outreach partner, it could be an athletics administrator. It could be the AD or an associate AD. It also could be the outreach manager from your healthcare partner. But it's really just anybody who, again, would be responsible to receive and respond to communications regarding, student athlete health, safety, and well-being. Angie, as we look at this concept of accreditation, and I know Dr. Borcher has always said that, accreditation is very common in higher ed. It's also very common in medicine, but it's not all that common in sports medicine. It's not all that common in collegiate sports medicine. But talk about this concept of accreditation, how it's used in medicine and higher education, and the benefits of an institution pursuing and maintaining accreditation, especially when it comes to demonstrating, you know, your you know your best practices in health, safety, and well-being.
Yeah, I think this is an unfamiliar territory for most of us that are dealing with athletic medicine in particular, but this is very common. Hospitals go through an accreditation process. Certain academic areas on a campus will go through an accreditation process. You'll go through an accreditation process for all types of things. And I think really what this is doing is it's just meant to be a checks and balance system. So for us, from a checks and balance standpoint, we're not looking to create a lot more tasks that you have to do. We're not looking to add things to your standards. We're looking just to make sure, are you meeting the minimum standards from a health and safety best practices, things that are already out there that are applicable to you at your NJCAA institution. Our goal is to support everybody through the process. It's not meant to be a punitive process. It's meant to be a supportive process. And I think one of the things that we find is we've gone through accreditation with other institutions and other areas of athletic organizations is that it does two things. Number one, it will identify some blind spots and maybe some things that you didn't know were considered best practice that may need to be added to your area. Or it may provide some support for those who are trying to get buy-in from their president on campus, or maybe an athletic director or an administrator, to show this is why we need our coaches to do CPR certification, for example, or this is another support of why we have to have access to AED, or provide basic coaching education. So a lot of people appreciate the fact when we find a couple of things like that to provide them some additional support as they're trying to advocate for those things in their organization. And then the second thing that I think it does, and this is probably one of the most important, it really celebrates the things that are going really well at an institution. There are a lot of things that are happening on campuses right now with very minimal resources that honestly, this accreditation can help highlight those things for you and show some successes of where you're meeting standards, rather than just highlight the things that maybe need improved upon.
Angie, that's a great point, and I will tell you that during our time of collaborating with the Welfare and Safety Council, a lot of the things that are mixed in with the accreditation are initiatives that the Welfare and Safety Council has been bringing forward for a number of years. So whether that is, the coach CPR and AED training, coach education around other important sports medicine topics, but also the designation of that athletics healthcare administrator. For a number of years, the Welfare and Safety Council has wanted to um, get an idea of who all the athletic trainers were in the NJCAA, how they could all reach each other, how they could, collaborate and get together. And we're hoping through this process that they end up with a really good database of folks so that they can communicate with each other about important initiatives. Ray, since you are all things of the nitty gritty portion of accreditation for us here at USCA, talk a little bit about the tools that an NJCA school can expect to have access to assist them as they move through this accreditation process.
Yeah, so once an institution has signed up, you will receive access to the athletics health space education program in July or probably early August. That education is meant to go out to your coaches, administrators, your athletic training staff, or your medical staff, as well as just anyone who's going to be surrounding those athletes on a day-to-day basis, with the goal of essentially making sure everyone's on the same page. So that education is going to touch on pieces that are somewhat considered catastrophic if they do occur. So you're thinking cervical spine injuries, concussion education, topics like diabetes or how to handle certain situations when it's so hot outside or maybe it's too cold, or thinking of potential air quality issues with all the wildfires and things like that we've had over the last few years in this country. So the goal of the education is just to make sure everyone's on the same page. And then the other component of this is going to be completing an annual assessment. Now, with this annual assessment, the goal is to make sure that you work your way through various different topics that we're going to ask you about. At the end of that, probably about a month or so after completion, we will then send you back a report. And within that report, we're going to outline all the information that you provided us, as well as some feedback or solutions based on the feedback or the data that you provided us. The goal of the assessment piece, especially, is just to make sure that you have a running tab annually on how you're constantly improving and to provide you solutions that are hopefully easy for you to implement or to provide you some guidance on how to implement those different solutions based on the resources that you state that you have. And then the other added benefit of this whole process is that we've also added on AHA membership for those who do sign up for the accreditation process. So the Athletics Healthcare Administration Association is another organization that we do run through USCA. And it meets, I would say, pretty much annually. We have, or not annually, monthly, we have a webinar regarding health, safety, and wellness needs of athletes throughout all athletic areas, whether it's professional sports, it might be collegiate based, it might be Olympic based or high school based, but just to touch on all those various different topics that are impacting athletes or pressing topics that might come up on the or immediately, I should say, or changes that are occurring. So various different tools that you will have access in the coming months. And the goal is to, of course, make your days easier, provide you with more resources, more solutions that you could then use to turn around things internally within your athletic departments or for your athletes as you move forward.
Thanks, Ray. And I would just add that as part of that Athletics Healthcare Administrator Association, athletic trainers can receive between 20 and 25 NATA approved continuing education units per year. So that's a good way for athletic trainers to receive that type of education virtually. So that's been a very popular part of all of our partnerships, and we're excited to be able to offer it as part of this. Angie, Ray talked about, coach and staff education when it comes to, important health and safety topics. We know that we see this with other organizations. Many state high school associations require this from their coaches. The NCAA does. A lot of sporting organizations have some sort of required coaching education. Can you kind of talk about that concept and the benefit of it? One for the coaches, but then two for the organization and the institution.
Yeah, I think it's, when you're talking about education, sometimes people get concerned for two reasons. Number one, they don't want to add more to a coach's plate when they're already busy. And number two, they don't want coaches to be healthcare professionals. And that's the role of the athletic trainer. And while both of those are true, I think more of what we look for from a coaching education perspective is how do I recognize and refer? So we want to make sure that they are having the basic education out there that they can recognize this is potentially a problem and they need to see a healthcare professional immediately, or I need to call a squad. An athletic trainer can't be everywhere. They can't be present for everything that's happening. That's just not possible and not even probably warranted when it comes to some of those low level, low risk events. So a coach, we want to be able to provide them some support and resources that, hey, you know what? This athlete is talking about having this really dark colored urine. And I remember taking that training from USCAH that could be a sign of something. Was it rhabdo? What was it? I'm not sure, but I know that doesn't sound right. So I got to refer them on. Like, I don't need them to know all the details of what they have to do if somebody has rhabdo. How do I stop the activity they're doing and refer them to the next person? It seems really hot today and we're getting these heat warning and heat illness, and this is why we can't practice. So when somebody tells me I can't practice, I understand the why behind it. So it's not complicated. It's meant to be very easy. It goes pretty quick, but our whole goal is to provide them enough background so they can recognize that there's an issue, refer them. They feel comfortable making decisions when it comes to calling a squad, because at the end of the day, that there is going to be a scenario where it's just an athlete and just a coach and not a healthcare professional. And coaches like to be armed with resources of what to do in those scenarios. So we found that once coaches have taken the training, they realize it's not super lengthy. It doesn't take a ton of their time, but it just provides them a little more comfort in, okay, it is okay for me to call the athletic trainer, or yes, I should call an ambulance, and that is okay. That's what I'm supposed to do, and provides them a little more support and resources. And that in turn helps the institution that you've helped from a risk management standpoint. Health and safety of student athletes is everybody's responsibility in an institution, not just those that are designated to take care the healthcare needs. So it's important that everyone has baseline training from an education standpoint.
Thanks, Angie. Ray, as we talk about the annual best practice assessment, we know we're going to be, collaborating with, that athletics healthcare administrator. So whether it's the head athletic trainer, director of sports medicine, or possibly the athletic director on this piece of the accreditation process, give us a little bit more information about that annual best practice assessment, how USCA came up with, the bullet marks for it, and how they can use it to ensure optimal health and safety for their student athletes and on their campuses.
Yeah, so as we were developing the assessment that's going to be very specific to the NJCAA, what we always do is we look at all the best practices that are out there from a sports medicine standpoint or health, safety, and wellness standpoint as it relates to athletes or athletics. A lot of the content is going to come from inter-association guidelines. So NATA might be involved, ACSM might be involved. But these are all guidelines or best practices that have been approved by multiple organizations that aren't even necessarily the big organizations, thinking of USOPC or professional sports or NCAA, so on and so forth. So as we develop this assessment, the goal is to make sure that you have a way of tracking what your progress is annually. So say, for example, this year we ask you questions on your staffing and how many athletic trainers you have, or do you have access to athletic trainers? This year you might say, no, we don't have access to this, but we do X, Y, and Z to make sure we have coverage. Now, maybe then be able to provide you some recommendations on how you might be able to obtain athletic trainers. And then from that point on, maybe your assessment next year says, oh yeah, we were able to obtain athletic trainers. This is what we did. And then you can see that annual progress as you do this assessment as you move forward. Now, the cool thing with an assessment as well is that sometimes you don't always realize what you might be missing or what you're doing well. But when you're asked a question, it provides you the opportunity to reflect on all of those things. And then receiving feedback from a completely independent third party also helps guide further movement or action as well. Now, one question that we always receive is, well, what can we do with this report once we have it? Do we just sit on this? Is it just good for us to know? And I think Angie's already alluded to this, where you can take the results of this report and continue conversations internally. And if you're a group that, yeah, we don't have too much or have access to a lot of resources internally, let's say you are partnered with a local health system or clinic, or you are using independent contractors or external providers, you could potentially use this report to have conversations with those entities and say, like, hey, are you able to provide maybe one or two more providers, whether it's for mental health, whether it's for medical care or physicians, so on and so forth, based on what you're seeing in this report? And it's not you saying we need it, but it's potentially a third party saying, like, based on what is expected or what should be occurring in this space, you should potentially look into having more personnel. So you can take this report and go various different directions. It will provide you information on personnel, provide you information on policies and procedures that you should have in place or should think about having in place, EAPs, really thinking about how you are functioning internally and providing guidance is the goal here. But again, you can take that assessment and accomplish many different things depending on what your needs are.
Hey Ray, a question came through in the Q&A, and it's probably I'm gonna give you a two-sided question since we're in the weeds, and these next few questions are few anyways. So
Okay.
we'll start with the coach education. Estimate how long it would take a coach to complete the annual coach education. That was the question from the Q&A. And again, we fully understand this question. Folks in athletics are busy. We're definitely sensitive not to add too much to anyone's plate. So let us know how long a coach could expect to take to get through the education portion.
Okay, so I'm gonna give you a couple of responses. So if someone were to just try and click through and complete the course without really retaining any information, I would say no longer than maybe 30 minutes, but obviously that's not the goal. This training is designed to be pretty efficient. It's all concise. It's all combined into one course. I would say ideally it takes about 45 minutes. Definitely shouldn't take longer than an hour, but it is also built in a way where you can take a few sections of the course, go away from it, and come back, and it tracks your progress. So it isn't something you have to complete all in one sitting. It's meant to move with you. So you can access this on a phone, you can access this on a tablet or a computer while someone's on the bus traveling. It's meant to move with you and also act as a resource for you to go back and look at if you need to get a refresher. So the safe bet is just to say it's going to take you an hour, and it's an hour of your time annually. That's it.
Ray, shifting gears for our athletic trainers and our athletic directors that maybe completed the assessment, what's your estimated time to complete the assessment annually?
If you know the ins and outs of your department, no more than 30 minutes. And that would be, I honestly think that would be a stretch. But if you potentially need to spend some time and ask people questions to obtain information for the assessment, I would say probably about an hour. So again, not meant to take a lot of your time annually.
Right. Great. Thanks. Well, Ray, while we're on you, and again, still in the weeds here, well, let us know the type of communication a school will receive from USCA throughout this accreditation cycle. There's a question in the chat about administrators being able to track progress, especially on the coach education. Just kind of talk about the communication and feedback loop that a school and their administrators and athletic trainers can expect to have throughout this process.
Yeah, so once you are able to sign up, so we'll make sure that you have the link for signing up for the accreditation process with us here at USCA following this meeting via email. Once you sign up and you complete the full application, you immediately will receive USCA has received your application. That will outline the next steps that you need to take at that time. And of course, this is going to change depending on the time that you actually do the application. So currently, if you complete this application, you sign up, we make sure that you have resources as far as how to sign up for the AHAA. This is how you touch base with our partner in this process via AG and a few other elements. And then we'll have further communication with you, like I mentioned, in July or early August on the next steps of getting your coaches, your administrators, and everyone else signed up for the annual education. Once you are signed up for or once those individuals are signed up for education, as well as you, the individual, once they've completed the education, will have the ability to print off a certification and send that to you. But we also plan on making sure that there is a site administrator for each location so that they can track the education of their coaches via their specific school. So again, the goal is to make this as seamless as possible, especially given the I say almost an attestation that you have to do with the NCAA on an annual or NJCAA on an annual basis as far as your membership renewal. So that will be a component there as well. But once we do get the education component rolling for you, and again, it's meant to align with the preseasons that are upcoming, and then you will eventually complete your assessment, you'll receive that report as well. Now, if you do elect to become a member of our AHAA program, you will also receive emails from the AHAA letting you know when webinars are coming up, when there are educational opportunities that are coming up, to just keep you in the loop of everything that's happening in the athlete health, safety, and wellness world.
Ray, you talked a lot about the process, but let us know what's square one. How can an institution get started with this? What's the first thing they need to do? Where can they go to get this all rolling and take the first step?
Yeah, so first step is going to be actually filling out the application and making sure that you're in our system so that we know we need to continue communicating with you on what's happening within the accreditation program. So once this webinar is complete, we will definitely share the link so that you can get signed up with the program. That will put you in our system, and then we'll get the ball rolling from there.
Ray, I'll add to that there's been probably two, maybe three emails that have come out from the national office that have links in there as well for folks to get started. And the default, if you don't remember all that, you can always reach us at info@usca.com, and we will respond and get you started that way. So a lot of different ways to enter the system, but we'll be sharing those quite frequently throughout the coming weeks. Angie, I think a big question, and we've seen it in the Q&A already, and again, it's budget season, so people are starting to think about this. Tell us, what's the cost of the accreditation program to an institution?
Yeah, I think a couple things to kind of hit a couple of the questions all at one time. I mean, this is part of the bylaws right now is maintaining accreditation through USCAH because this is new and it's a requirement. We do have a sponsor for it. So our friends at AG Specialty Insurance, who have been a long-term partner of USCAH, are covering the cost for all of the accreditation. So it's going to be completely free for you. We already have about 50 institutions that are enrolled. The extra benefit to that is that we are hearing from some of our enrolled institutions that AG is able to reach out and talk to you about your current insurance policy and whether there could be a potential insurance discount just because this is a risk management and insurance companies like risk management strategies. So there have been some positives that are coming out of that as well. But right now, this program is completely free. We're enrolling people now just to get you started in the process. But if you're enrolled now, you'll start with the education and can definitely benefit from our programming. I think the other question that's coming up a lot that's kind of popping very, very quickly is who has to be the athletic healthcare administrator. And Bob, I don't know if you want, I know we've touched on that briefly, but if you want to answer that again based on what answer we've been providing for individuals.
Yeah, no, again, I think the athletics healthcare administrator, if you have a head athletic trainer or a director of sports medicine or a lead athletic trainer on your campus, that's probably, that would be probably option 1A. But also appropriate would be the athletic director or an assistant AD. Some schools have told us that they're going to, work with their healthcare partners, so their local hospital that provides them athletic trainers and maybe make an administrator from that group, their athletics healthcare administrator. So it's really just someone who can respond and communicate about these topics and about accreditation. So those would probably be kind of in that order, the best folks to do that.
And I think also to answer the question about how accreditation fits in with your governing bodies for your institutions already, this is a separate accreditation meant specifically for your athletic organizations as part of the NJCAA and being a member of the NJCAA. So it's meant to look at healthcare services provided to your student athletes.
Angie, one last question for you, and then we will go through and try to answer as many of Q&A that lives in the lives in the chat. But talk a little bit more just about obviously AG stepped up to help fund this program, but just on a general scale, why is the insurance industry interested in this programming, and how do they view kind of institutions adhering to best practices, completing accreditation, things like that?
Yeah, I think that's a great question. I mean, one of the reasons this is attractive to the insurance industry is that it just has a third party that's looking at it to verify you're following best practices. And obviously, that's a risk mitigation strategy to provide extra assistance and support to your institution. So, can't guarantee that there would be some kind of contractual rate reduction, but it's definitely attractive. And we are finding some people that are getting quoted a lot different for their premiums amount. And I know that some people are already using AG as a secondary insurance person or as part of the contract. They are the insurance experts. We are not. So once you've enrolled into our process, we will have somebody from them reach out to you and talk about the specifics when it comes to the insurance piece.
Great, thank you. I'm going to just take one of the questions that's here in the Q&A about the first aid certification, which lives in the bylaw. So there's an entry there about first aid certification required for coaches and staff. That is part of the coach education. So the coach education that we're offering through the accreditation will count for that coach certification, and there won't be any further need for an additional first aid course. So that's kind of, that's how we've addressed that part of the bylaw. It's more of a first aid for athletics. And again, we provide this this coursework for a number of different athletics organizations.
Yeah, and I think when people are talking about having per diem athletic trainers or utilizing per diem athletic trainers, I think that's one of the reasons why this accreditation process is important, is as you're getting turnover through your organization, that somebody within your institution can attest to meeting best practices. Even though you may have various healthcare professionals coming and going, you can still ensure that your coaches are having your CPR certification, you have AEDs readily accessible, you have coaches training done. So it's not meant to really be prescriptive on the number of athletic trainers you have to have in a specific place, but whether you're utilizing your resources the best.
I'm going to touch on a couple of these assessment questions that I might have already answered, or these questions might have came through before we talked about it. But the assessment will be online. So it's all online prompted questions. So it's nothing that you need to personally start thinking of yourself to answer. So they're online prompted. You don't have to upload any documents or physically provide anything. Everything will be there for you to complete. As far as when the assessments will be given this year, we'll make sure that everyone has access to the assessment link. From that point forward or after this year, we will create a rolling schedule by region so that you'll have a couple months that you'll have to complete your assessment in. And then annually, that will be your process so that you don't have to worry about cramming this in whenever you think you have the time. So it might be region 1 and 2 during August, September, then 3, 4, so on and so forth. But we'll work through that process once everyone does get enrolled to the program, but that will likely begin in year 2. Looking at is there also student athlete education? The actual education that we make available to your coaches, administrators, support staff, student athletes could also potentially take that as well. But just understand, as part of this accreditation program, we're not looking to track those specific individuals, because one thing we always hear, like Bob has alluded to, time. Student athletes are constantly being inundated with educational elements that they have to complete. But it's always an added benefit. But just know, as far as the USCAH accreditation process, we aren't tracking student athletes as far as completing that specific content. Now, there might be a little bit of a discrepancy here on this next one. We do not have a partnership with the American Heart Association. known as the AHA. Our organization that tracks the athletic administration or of healthcare for athletes is called the Athletics Healthcare Administration Association. So it's a little bit different. So that isn't something that's going to fall within our realm of accreditation here either. All right. Just scrolling here to see. You're
Hey,
asking.
Ray, a question we've gotten a couple times. Can an institution name two people as their healthcare contact? And I would think this would be the case where the AD might want to kind of have visualization on what's going on, but maybe their other healthcare contact is the outreach manager from the hospital system that supports them. Is there a way where communications could go to two folks at an institution?
The way the system is currently set up is that we will have one primary contact, and then that primary contact could, of course, pass on any other information internally. Now, the NJCAA, when you're going through your renewal cycle, might allow for you to assign multiple people to that role. But as far as what we're doing within the USCAH accreditation process, we'll have one primary contact.
Great, thank you. I'm looking at these questions. I think we've covered most of them. Angie, Ray, any of them that you've seen in there that we need to jump on? I know there's a lot of questions. I will say that there's questions about um, is this mandatory? What if coaches don't do this? The compliance related questions. Um, this since it did go through a bylaw process, this is a mandatory initiative from the NJCAA. I think it's our hope, and I will tell you we've gotten great response so far from about 50 institutions that are that have reached out to get started. But it's our hope that folks do jump in and do this, but it is a required element from the NJCAA. How that gets tracked, and someone asked about penalties. I think those are things that we're waiting until we see what the initial response is. Until I'm sure the NJCAA will weigh in on how this is going to be monitored and what would happen if a school weren't to comply. But I think for right now, we're in this startup phase. We're excited. We've gotten great response, and I think those things we'll look at as we move down the road.
One thing I think we should make clear based on, because I know we've had a couple questions come in regarding first aid, CPR, AED training for coaches. By no means are we saying that the coach's education that is through the accreditation process, that is not replacing the need for first aid, CPR, and AED training. Those are definitely two separate components and two separate certification processes. You should always go through first aid, CPR, AED training usually on a minimum of a 2-year cycle in person to make sure that you are maintaining the ability to complete those various different tasks.
Yeah, and I think to answer the questions about independent medical care, I think that the intent is that if a healthcare professional makes a decision, they're the ones that those decisions have to be followed. So if they're making a decision about the return to play or a diagnosis of an injury, it can't be overruled by a coach or an administrative personnel. I think that's what you were trying to ask. And so those could be per diem individuals or those could be full-time individuals at your institution, but ultimately healthcare decisions should be made by healthcare personnel.
Hey, Bob,
Again, we're trying to work through all these questions the best we can. They're coming in pretty
Yeah.
quickly, so we're doing the best we can.
Yeah, Bob, there is a question, if you scroll to about 1:29 p.m. regarding bylaw number 3 and kind of talking through the autonomous nature of what that person looks like in that athletics healthcare seat.
Yeah,
And
no,
I know
that
Andy
that's a great
talked a little
question.
bit. Yeah.
That's a great question. I think Angie just alluded to it a little
Yeah.
bit, but I think that it's just important that in reporting lines, athletic trainers don't have a direct report to coaches, that they feel empowered to make decisions, even if they're coming only to provide game day coverage. It certainly doesn't mean that Although we would hope that NJCAA institutions that don't have athletic trainers would look to create a more formal relationship with an athletic trainer, it certainly doesn't mean it doesn't force that. But what it does mean is that that athletic trainer, whether they're just there for a game or they're on campus, has the authority to stop something that's unsafe. That their medical decisions are not challenged by coaches, student athletes, parents, others, and that they're able to maintain that safe and healthy environment.
Yeah, and I do think as we're getting some questions about these bylaws, I think we're probably best to answer the question specific to the part that is about the USCAH accreditation versus kind of the enforcement of the bylaws part. As these questions come up through the accreditation process, obviously we're going to pass these on to the NJCAA office as well. But as far as the accreditation process, our goal here today is to explain all the details regarding that. I think we hit all the accreditation questions at this point. Do you, Bob?
Yes, I agree. I agree.
And I put the info@usca.com in the chat for people to set up a meeting if they have additional questions that are specific. Each institution we know looks a little different. So you may have specific questions that may just apply to you that we'll set up a quick meeting to review.
Well, we thank everybody for their time. We know it's the summer. We know that there's a lot going on out there, and your free time is scarce. So we appreciate everybody joining us. Expect to see information coming from us and from the national office about this throughout the summer. And I'm certain that we will have other opportunities like this to get together and get feedback and answer questions. But we appreciate everybody joining us today. Thank you.